Welcome to this video on anxiety, obsessive-compulsive, and related disorders. These conditions represent a significant area of mental health that you will encounter frequently in your nursing practice across various settings. Understanding the nuances of these disorders is crucial for providing effective, compassionate care to your patients. We will explore their definitions, prevalence, symptoms, and, importantly, the nursing role in assessment, intervention, and management. Anxiety is a fundamental human emotion, a natural response to stress. It's a feeling of apprehension, uneasiness, uncertainty, or dread resulting from a real or perceived threat. While a certain level of anxiety can be motivating and help us prepare for challenges, it becomes problematic when it is excessive, persistent, and interferes with daily life. This is when we begin to consider it as a clinical disorder requiring attention and intervention. Anxiety disorders are among the most common mental health conditions globally. They affect a significant portion of the population, often beginning in childhood or adolescence. Research consistently shows a higher prevalence among women compared to men. These disorders frequently co-occur with other mental health conditions, such as depression, substance use disorders, and other anxiety disorders, as well as physical health problems. Understanding these statistics helps us appreciate the scope of the issue and the importance of early identification and intervention. Distinguishing between normal, everyday anxiety and a clinical anxiety disorder is key. We consider anxiety to be problematic when it is disproportionate to the actual situation causing it. For example, feeling nervous before an exam is normal, but experiencing debilitating panic attacks for weeks leading up to it is not. Furthermore, anxiety becomes a disorder when it significantly interferes with a person's ability to function in social situations, at work or school, or in other important areas of their life. Panic is the most severe form of anxiety. It is characterized by a sudden, overwhelming feeling of terror or impending doom. A panic attack is an abrupt surge of intense fear or discomfort that reaches a peak within minutes. These attacks are often accompanied by a range of intense physical, cognitive, and behavioral symptoms that can be extremely frightening for the individual experiencing them. The symptoms of anxiety and panic are diverse and can manifest across multiple body systems. Cardiovascular symptoms might include increased heart rate, palpitations, and chest discomfort. Gastrointestinal issues like nausea or diarrhea are common. Musculoskeletal tension, tremors, and fatigue can occur. Intellectually, individuals may struggle with concentration, experience racing thoughts, or have difficulty communicating. Socially and emotionally, they might feel helpless, fearful, angry, or withdraw from others. Recognizing this wide array of symptoms is vital for comprehensive assessment. Panic disorder is specifically characterized by recurrent, unexpected panic attacks. These attacks are unpredictable in their onset, meaning they don't always occur in response to a specific trigger. Individuals with panic disorder experience intense apprehension, fear, or terror, often accompanied by feelings of impending doom. The physical discomfort during these attacks is typically very intense and distressing, leading to significant worry about future attacks or changes in behavior to avoid them. Several factors can predispose individuals to developing anxiety disorders, including panic disorder and generalized anxiety disorder, GAD. GAD is characterized by chronic, unrealistic, and excessive anxiety and worry about multiple events or activities. Predisposing factors can include prolonged unmet needs for security or attention, stressful life events that threaten security or self-esteem, and the surfacing of unacceptable thoughts or feelings. biological factors such as genetics, neuroanatomical differences, and imbalances in biochemical and neurochemical systems also play a significant role in vulnerability to these disorders. Anxiety exists on a spectrum, typically described in four levels: mild, moderate, severe, and panic. Mild anxiety is common and can enhance alertness and perception, causing only mild uneasiness. Moderate anxiety narrows the perceptual field. Physical symptoms like a pounding heart or clammy skin may appear, and comprehension can be impaired. Severe anxiety significantly limits the perceptual field, making focus difficult. Symptoms of moderate anxiety worsen, and distorted thoughts like hallucinations or delusions may occur. Panic is the most extreme level, where the individual is unable to process environmental stimuli, may lose contact with reality, and cannot function, sometimes regressing to primitive behaviors. Ego defense mechanisms are unconscious psychological strategies used to cope with anxiety by keeping unacceptable thoughts or feelings out of awareness. They can be adaptive, helping us navigate stress in healthy ways, or maladaptive, leading to distorted perceptions of reality or interfering with healthy functioning. Examples include denial, where one refuses to acknowledge a difficult reality; displacement, shifting emotions to a less threatening target; projection, attributing one's own unacceptable feelings to others; and compensation, striving to overcome perceived weaknesses. Other important defense mechanisms include introjection, where one internalizes the characteristics of another person; repression, unconsciously pushing distressing thoughts out of awareness; reaction formation, expressing the opposite of how one truly feels; and regression, returning to earlier, less mature behaviors. Dissociation involves detaching from painful experiences. Suppression is consciously choosing not to think about something, distinct from unconscious repression. Sublimation is channeling unacceptable impulses into socially acceptable activities, often considered a mature defense mechanism. Recognizing these mechanisms helps nurses understand patient behavior. When caring for patients with anxiety disorders, common nursing diagnoses often center around the patient's ability to cope and their experience of anxiety itself. Ineffective individual coping is a frequent diagnosis, reflecting the patient's difficulty in managing stressors and their anxiety response. Anxiety is another core diagnosis, directly addressing the patient's subjective experience of apprehension and worry, and the physiological and behavioral manifestations that accompany it. These diagnoses guide the development of individualized care plans. Nursing interventions for anxiety are aimed at reducing the patient's distress and helping them develop more effective coping strategies. General principles include assessing the patient's anxiety level using standardized tools and observing their behavior. It's crucial to keep the environment calm and minimize stimulation when anxiety is high. Nurses should maintain an accepting and helpful attitude, acknowledging the patient's feelings without judgment. Specific actions involve encouraging the patient to verbalize their feelings, helping them clarify the source of their anxiety, and recognizing that defense mechanisms, while sometimes maladaptive, serve a purpose in managing distress. Further nursing interventions involve implementing specific measures to decrease anxiety, providing direct care tailored to the patient's specific anxiety disorder, and administering prescribed anti-anxiety medications as ordered. It's essential to use realistic and measurable objectives when evaluating the effectiveness of these interventions. Medications commonly used include benzodiazepines for short-term relief, buspirone for generalized anxiety, and sometimes beta blockers like propranolol to manage physical symptoms like tremors or palpitations. Desired outcomes for patients with anxiety disorders focus on reducing the severity and impact of their symptoms. We aim for the patient to experience a decrease in their overall anxiety level. Key outcomes include the patient being able to recognize the signs of escalating anxiety, such as restlessness or increased physical symptoms. We also want them to identify the specific triggers or precipitants of their anxiety. Ultimately, the goal is for the patient to establish and utilize more effective coping mechanisms, and as a result, experience increased self esteem and improved functioning. Phobias are characterized by a persistent, intense, and irrational fear of a specific object, activity, or situation. This fear is so strong that it compels the individual to avoid the feared stimulus at all costs. When confronted with the phobic object or situation, individuals typically experience intense anxiety or even a full blown panic attack. Assessment involves identifying the specific fear and the resulting apprehension and helplessness. Examples include acrophobia, the fear of heights, or claustrophobia, the fear of enclosed spaces. Agoraphobia is a specific type of phobia defined as the fear of being in places or situations from which escape might be difficult, or help might not be available if panic like symptoms occur. This fear often leads to avoidance of situations such as using public transportation, being in open or enclosed spaces, standing in lines, being in crowds, or being outside the home alone. Nursing considerations for phobias include avoiding confrontation, not forcing the patient into the feared situation prematurely, and utilizing techniques like systematic desensitization, relaxation, and general anxiety management strategies. Obsessive compulsive disorder, or OCD, involves two core components: obsessions and compulsions. Obsessions are recurrent, persistent thoughts, impulses, or images that are experienced as intrusive and unwanted, causing significant anxiety or distress. Compulsions are repetitive behaviors or mental acts that the individual feels driven to perform in response to an obsession or according to rigid rules. The purpose of compulsions is to prevent or reduce anxiety or prevent a dreaded event, but they are often not realistically connected to the feared outcome. The defining feature of OCD is the presence of these obsessions, compulsions, or both, which are severe enough to be time consuming or cause marked distress or significant impairment in social, occupational, or other important areas of functioning. Assessment involves identifying the specific content of the obsessions and the nature of the compulsive rituals. Nursing considerations include accepting the ritualistic behavior initially while working towards reducing it, structuring the environment, ensuring physical needs are met despite the rituals, and offering alternative activities. Encouraging socialization and considering medication like SSRIs are also part of the management plan. Anxiety symptoms can also be directly caused by the effects of substances. Substance-induced anxiety disorder may occur during intoxication with certain substances or during withdrawal from others. A wide range of substances can trigger these symptoms, including alcohol, sedatives, hypnotics or anxiolytics, amphetamines or cocaine, hallucinogens, caffeine, and cannabis, among others. It's crucial to assess substance use history when evaluating anxiety symptoms to identify potential substance-induced causes. When evaluating the effectiveness of interventions for anxiety and related disorders, we use realistic and measurable objectives. These outcomes help us determine if the patient is making progress towards managing their symptoms and improving their quality of life. Evaluating the effectiveness of care for anxiety and related disorders involves assessing the patient's progress against established goals. We ask questions like, can the patient recognize the early signs of escalating anxiety? Are they using the coping skills they've learned? Can they maintain their anxiety at a manageable level, perhaps eventually without medication? For phobias, can they discuss the feared object or situation with less anxiety or even function in its presence? For OCD, are they refraining from rituals or using substitute behaviors? Are their daily activities less restricted? Has the frequency or intensity of anxiety episodes decreased? Can the patient ask for help and talk about their feelings? These questions guide our evaluation of treatment success. Treatment for anxiety, OCD, and related disorders often involves a combination of approaches. Individual psychotherapy provides a space for exploring underlying issues and developing coping strategies. Cognitive behavior therapy, CBT, is highly effective, focusing on identifying and changing negative thought patterns and behaviors. Behavior therapy techniques like systematic desensitization, which gradually exposes the patient to the feared stimulus while teaching relaxation, and implosion therapy or flooding, which involves intense exposure, are particularly useful for phobias and OCD. Other non-pharmacological treatments like deep breathing, progressive muscle relaxation, imagery, mindfulness, and exercise can also significantly help manage anxiety symptoms. Psychopharmacology plays a significant role in managing these disorders. Anti-anxiety agents include benzodiazepines for acute relief, buspirone for GAD, and sometimes hypnotics like zolpidem or zaleplon for sleep disturbances related to anxiety. Beta blockers like propranolol can help with physical symptoms. Specific medications are often targeted to different disorders. Continuing with psychopharmacology, medication choices are often tailored to the specific disorder. For panic disorder and GAD, anxiolytics, antidepressants, especially SSRIs and SNRIs, and sometimes antihypertensive agents like beta blockers are used. Phobic disorders may also be managed with anxiolytics, antidepressants, or antihypertensives, particularly when panic symptoms are present. For OCD, antidepressants, specifically SSRIs, and the tricyclic antidepressant clomipramine, are the first-line pharmacological treatment, often at higher doses than used for depression. Understanding these medication classes and their uses is essential for nursing care, including administration, monitoring for side effects, and patient education.